Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now today is going to be a fascinating show where we'll try and find out that of late, so many projections being made, remember, for the third wave. But on the program, we've got a projection being made by a highly qualified set of scientists. These experts got together and they didn't just get wave 1, but they also got wave 2 correct. It was bang on based on their projection. So we will understand from them what exactly is it that they're projecting for wave 3, how are these projections made, and how bankable are they really at this point, and thus perhaps telling us all what to really look forward to or not when it comes to the third wave in India. So without any further ado, let's get into our explainer. Well, first up, we try to understand from this set of group of scientists which are doing this projection called the Sutra model of projection, on what exactly were the factors on which they have based this projection, right? So we looked at them and these are some of the key things. It is, of course, based on the R factor or the reproductive rate of the virus. It depends on the vaccine numbers, the possible reinfections and the new variants coming in as well. Now, remember, what these people have done is they have made a formula that will make a projection for not just a third wave, for any further wave to come really. And these things that I just mentioned is what that formula is actually based on. This has been broadly based on this projection, but to make you understand simply, let's try and decode why does a wave actually come. Now that's due to either a faster spreading mutant or people not following COVID appropriate protocols at all. If both happens together, that's what happened in the second wave, remember, then the intensity of a wave is much more, right? So we understand that new variants, COVID appropriate behavior is key to the onset of a wave. The third crucial thing that can save you and I from a third wave, a possible reinfection and mostly death is, of course, vaccines. And how good or bad are India's vaccination numbers looking like? Let's decode that as well. Now, what is the India vaccination equation at the moment? Now, to vaccinate all adults by the end of the year, which is the deadline set by the government, we are required to vaccinate at least 8.6 million people every day. So what we've done is we've got a 7-day average for you, and that comes down to about 4 million each day. That means there is a deficit over there. Last date where we have absolute numbers here is on 4th of July, which had 1.5 million vaccination. A caveat over here is that 4th of July was actually Sunday and numbers usually slip that day. But this also means that we really need to make up for that shortfall during the week as well that follows. At the moment, the shortfall not looking very impressive at 4.6 million a day. And this shortfall is what we need to meet if we want to defeat and avoid a third wave. And if you're still not convinced about the role of vaccine, sample this. Lesser vaccines will mean higher caseload. Lesser vaccines will also mean more hospitalization in the future waves, and lesser vaccines will also mean more deaths in the future waves. In addition, according to the Sutra model that we're discussing today for COVID-19, the first dose, they say, reduces the infection approximately by 25 to 30%. Now remember, this has been taken across the vaccines available with different efficacies, etc., and they've taken a broad estimate of how much of infection will they stop. 2 doses will reduce the risk of infection approximately by 50 to 60%. Now this is sort of an average, like I said, of the various vaccine efficacies that have been factored in. But talking about the Sutra model, question is, there are several projections out there. Why is this one credible? Fair question. Now, to test that, we actually went back in time to see the same model produce results for the first and the second wave. So, sample this. This is, you see 2 lines over here. Now, the yellow line that you see marked over here is the model and the wave that was computed following the Sutra model. And what you see is a blue line, almost overlapping at most places, that is the actual data. That tells you that this model actually worked. You see almost an overlap over there in the first wave. What about the second wave? So many people did not anticipate it at all. The same Sutra model looked at the second wave as well. And again, you see, they have a couple of projections. They have lower bound, upper bound projections. They also had to anticipate a couple of things, but they mostly, this one again, you see, having an overlap over here. So they got the second model also right. Now that brings me to everybody asking, so what are they projecting then for the upcoming wave as well? Well, let's get to the climax straight away. Let's talk about dates first on what is being projected in this model. Now, the third wave, according to the Sutra model, could hit the peak between November and October. So this is around Diwali time that we're looking at a possible getting in or a peak of the third wave. Next, the intensity, they looked at that as well, and that they say the third wave, according to this model, will see half the daily cases recorded during the second surge. Having said that, the model actually makes 3 scenarios for the third wave, talking about the different intensities of wave that will actually come in. There is an optimistic model or a scenario, there is an intermediate scenario and a pessimistic scenario as well. Because remember, it all really depends on the vaccination numbers and human behavior as well, which is so hard to actually put down in terms of absolute numbers. So let's look first at the optimistic scenario. I'll take you to the graph in just a bit. Now, life goes back to normal, and by August, there are no new mutants as well. In that scenario, the daily cases could be in the range of 50,000 to a lakh. Okay, so no new mutants, and we still continue to unlock at the pace we are unlocking. And there, the best case scenario really is that we'll have between 50,000 to 1 lakh cases a day. In the intermediate scenario, vaccination is 20% less effective with the onset of new mutants perhaps, and means cases could be in the range of 50,000 to a lakh again. Now, in the third scenario, this is an extremely pessimistic scenario that they have picked up, a new 25% more infectious mutant spreads, leading to a third wave that could be as high as 1,50,000 and 2 lakh cases every day. Now, this is significant, of course, because you're thinking this is even the worst case scenario. According to this model, let me just remind you again, remains to be much below what we saw in the second wave. All right, but also significantly higher compared to the first one. That brings me to this graph that they have set out. Look at this over here. We, of course, don't have the absolute numbers at this point, but this is what the Sutra model talks about as the worst case scenario, the most pessimistic scenario right now, and that also is half of what we saw as the peak of the first wave. You also see the timing over there falling right around Diwali. That's another worry that we have to look at. All right, so that's pretty much what we have to say about this Sutra model, but lots of questions still pertaining to how dependable is this, how exactly did it come into being, etc. And for this, we are joined by the people behind it. We have with us Professor Manindra Agarwal from IIT Kanpur. We have Lieutenant General Madhuri Kar, she's the Deputy Chief Medical for Integrated Defence Staff, part of the team that made this. And we also have with us Professor Vidyasagar from IIT Hyderabad. All right, so thank you all so much for your time, and congratulations for getting the past few waves correct, and we really hope that this one falls true as well to start with, because this, even the worst case scenario according to your model says that it won't be as significant, or should I say, and I want Professor Vidyasagar to answer that, are you seriously at the end of this projection saying that the worst of the COVID crisis is behind us?
Well, subject to the assumptions that you highlighted so nicely, we have been very, very conservative. We assume that the first dose of the vaccination reduces the risk of infection by about 25%, and the second dose also by another 25%. These are very conservative assumptions. In reality, the first dose of vaccination reduces the risk of infection by about 40%, and the second dose again reduces by another 40%. So we brought this down from 40% to 30% just in case there is a mutation that is capable of escaping vaccination. And we, in the pessimistic scenario, we brought it down still further to 25%, as you mentioned. So with all those assumptions, we feel fairly confident that unless something very, very dramatic and unforeseen happens, we should not see a very drastic third wave. And one thing you did not ask, but I will answer anyway, which is if our assumptions are going to go wrong, if there is, for example, a mutation that is much more infectious than what we have seen thus far, when will we know? That is, will we know only when we're in the midst of the pessimistic wave, or will we know ahead of time? And our simulations show that we have a lead period of approximately 3 to 4 weeks to detect that there is, in fact, a more virulent and more infectious mutation so that the planners can take this into account.
All right. Well, thank you for answering the question. That was quite significant over there. Let me go next to Lieutenant General Madhuri over there. So, in the pessimistic scenario, that's the worst case that can happen according to your model. You do mention that in case there is a new variant that comes in, which is 25% more infectious and comes around August, that is what the scenario will lead to. My question is, do you think Delta Plus at this point is that variant which has a potential of destroying this entire graph in this projection?
At the moment, the data which has come in does not support the thing that Delta Plus is going to be so much more serious, because we've not seen it scale up so fast. That is the rate of rise, or as we see, because things are opening up, but the number of cases rising are not that heavy. Secondly, the data which is the virologists and who worked on it have found that the Delta Plus variant, though is able to cause the disease, but the ability to attach to the receptors is not as strong as the Delta itself. So it may be a little more than your previous older strains, but we don't expect Delta Plus to be the bad guy. I mean, if what we have hypothesized is that if there is something worse than Delta, and Delta Plus so far has not proved to be worse.
Okay, good to have that clarified as well. Let me go to Professor Agarwal next. Professor Agarwal, all of this projection that you've made immensely also depends on immunity, right? And the question of loss of immunity is a complex one, I understand. So, in your understanding and how you've made these projections, what has been your understanding of how soon the immunity will fade? And I have this in two folds. One for those who actually contracted the virus, that is infected people, and then versus those who've taken the vaccine.
So, we have also taken, as Professor Sagar said, a rather conservative view or approach here for loss of immunity. About vaccination, he has already explained that those who got vaccinated, we are assuming that at least 40% of those lose immunity. Actually, they don't develop immunity at all. So that's a very, very conservative or pessimistic view. In reality, it's probably better. Similarly, for those who were infected earlier, we have assumed that those who got infected prior to the Delta variant being active in India, 40% have lost immunity by now. Again, this is a very conservative take on the reality.
Okay.
And those who got infected in the second wave, 20% of them have lost immunity now. There are studies done last year which talk about loss of immunity between 5 to 20%. So it's a wide range that exists about loss of immunity, and we have taken the worst possible situation of that.
Okay, I see. But I have a follow-up question to that. Then the question that comes to mind is healthcare workers who were amongst the first to get vaccines in the country. How are they placed when it comes to the third wave, and how safe are they then?
Actually, there is one point that our model is not talking about is the severity of infection. We count everybody who got infected as one individual infected. But it is a very well established fact that those who got infected earlier, they may get reinfected. Similarly, those who got vaccine, they may get infected, but the severity of such infections is rather low. So when we talk about healthcare workers who have all been vaccinated, perhaps even some of them have been infected earlier, even if they catch infection now, the severity will be very minimal, and therefore there should not be much to worry about.
Okay, I saw Lieutenant General Madhuri wanted to say something on that one. Please go ahead, ma'am.
Yeah, this was in keeping with the same thing that the severity of disease is not. However, we are still looking at the real loss of immunity following vaccination. I mean, that data is not yet available, whether, and there is a lot of scientific work going on, whether they need a booster. Because like you correctly pointed out, we started with healthcare workers first. So the first lot of healthcare workers have got the vaccine, you know, right in the beginning of the year. So how that would pan out over the time, and whether there would be any decreasing immunity, and what is the effect of these people who may have had a mild infection after vaccination but not presented with a disease, because that would itself act like a booster. So there would be a lot of yes. So these permutation combinations would have to, I mean, if you want to be exact, we would need data, but the model takes it as a general measure.
Right. In fact, not just for India, that data is actually being much awaited across the globe to try and understand about what exactly, to what extent do these vaccines actually save you. Next, I want to come back to Professor Vidyasagar and understand, your model does not project about when these infections happen in the third wave, which group of people are most vulnerable. We've heard these conflicting reports in the past where there have been reports saying that kids are most vulnerable, then some experts saying, no, that's not going to happen at all. So did you look into area of vulnerability and age group?
Yes, we're going to do that. But before I answer that question, I'll just like to elaborate on what my two colleagues have said. The data from UK is very interesting. With your permission, I'll just follow up on that. The UK had 4 waves. They are now in the midst of their 4th wave. Their 3rd wave was devastating. It was in December of 2020, January of 2021. They had 60,000 cases per day and 1,200 deaths per day. That was their 3rd wave. Now they're having about 21,000, 22,000 new cases per day. More than a third of the cases in this 3rd wave. But deaths came down from 1,200 to 14, 15, 16, like that. So this shows that there really isn't the same risk of severity as Professor Agarwal was pointing out. Now to come back to your question, thank you for indulging me with that comment. To come back to your question, so there are various seropositivity surveys. There is one by All India Institute of Medical Sciences, one by the Indian Council of Medical Research, and what they do is to measure what fraction of people have antibodies. So that tells you whether these people have been exposed to the disease, have developed some antibodies, and therefore will have some some immunity against reinfection. What is interesting in both the AIMMS study and the ICMR study is that in both cases, the presence of antibodies in children is just about the same as the presence of antibodies in adults.
Right.
So this means that children have been exposed. This is not going to be a new phenomenon. They have already been exposed.
Asymptomatic,
so therefore, they are already protected. They are already protected.
Right.
So that's the point that we need to keep in mind.
Just